So right now, the newest treatment option for myeloma is CAR T cells. That's chimeric antigen receptor T cell. And the one that's been approved most recently for myeloma is idacaptogene vicleucel, or ide-cel. Um, so this CAR T cell therapy was granted accelerated approval by the FDA, and it's indicated after 4 or more lines of systemic therapy. So, like I mentioned before, that has to include, previously being exposed to a proteasome inhibitor, an immunomodulatory agent, and then anti-CD38 monoclonal antibody. So when we do a 3-drug regimen, in most cases, people are already being exposed to 2, after their first relapse, they may get exposed to the third one. So by the third relapse, they would already be eligible for CAR T cells. So it's not something that you would have to wait and wait and wait to be eligible for this new treatment. Like all treatments, you have to be aware of potential side effects. When it comes to CAR T therapy, the biggest concern is cytokine release syndrome. A lot of us have probably heard a lot about that now, and in light of COVID and the systemic immune response that takes place. So we're talking about things like fever, hypotension, mental status changes. So this is one of the major side effects of CAR T therapy. You can also have neurologic events, and then the typical side effects that we typically see in cancer treatment. So things like infection or prolonged cytopenias, like low blood counts, anemia, white blood cells, platelets, among other things. So that's really the biggest treatment option on the scene right now with myeloma.